With the guidance and support of Bloomberg Philanthropies Data for Health initiative, Solomon Islands, a nation comprising over 1,000 islands, began implementing modern civil registration and vital statistics systems in 2016. The country faces unique challenges. All impede collecting and distributing reliable data about births, deaths, and people's health, leaving the government to rely on assumptions and guesswork to make critical decisions. While there's much to do, the new strategies have had a positive impact that is already felt across the country.
At that time, there was no register of any deaths in the Solomons with the civil registration. It was not really functional at that time, so we actually didn't know who's dead, who's alive.
Before there was this training medical certificate cause of death, things were like ad hoc, yeah? We don't have reminders. We don't know where the medical cause of death certificates are around in the wards.
The Western Province is scattered with a lot of islands, and all the health facilities are situated in those islands.
Despite the huge challenges presented by the Solomon Islands' scattered geography, the country has implemented modern and creative methodologies to increase the accuracy and flow of civil registration data and vital statistics.
With the support from the Bloomberg Philanthropy Data for Health initiative, they've supported us with trainings, especially with the medical professionals. They've undergone training on medical certifications that is involving the using of the international standards.
The country is training medical staff on medical certification of cause of death, implementing verbal autopsies at the community level, and making conscious efforts to integrate, digitalize and standardize civil registration and health data.
When we have data, we know how many people, how many patients die from certain diseases. And that will help us, clinicians in the hospital level, to focus more on those diseases that are causing more deaths.
These initiatives have facilitated the government's provision of care and improved health in the population. Improved death data has led to the identification of non-communicable diseases as the main cause of death, allowing doctors to proactively protect the most susceptible groups in Solomon Islands. Nearly 80% of deaths in Solomon Islands occur at home. In remote communities, verbal autopsy interviews are conducted by trained nurses with relatives of the deceased.
The process of reporting the death by using the verbal autopsy form is when there is a death occurred in a community, there are ways in which information reaches the nurse. It is very important to know the causes of death happen in the community, because if those deaths are preventable or avoidable, then it will also save other lives.
The implementation of the medical certification of cause of death form for health facilities and expansion of the verbal autopsy program for community deaths are reshaping how the country understands mortality. To overcome the many challenges in collecting health data, the government is implementing an integrated CRVS system that, supported by the right infrastructure, will be widely accessible, simplifying and streamlining data collection, analysis, and distribution.
These medical causes that it's a hope. It's a hope for future. Without this cause of death, we don't know where we are going. I don't only see numbers, but I see hope in the numbers. Data is precious. It's precious because we use it to save precious souls.